always love it when we get our physicians in. We've got a world-class medical community here, and we try to highlight what's available with Vidant Health in our Vidant Spotlight that we do at least once a month. And this morning I'm really interested because we're going to talk about orthopedics. Dr. Shawn Yeazell.
Good job, man.
Did I get it?
Yeah.
Shawn Yeazell is orthopedic shoulder and sports surgeon with Vidant Orthopedics. And it's that time of year, Doc, when football injuries and soccer injuries and things are happening. So I'm sure you stay pretty busy.
I do, yeah, and it's great to see athletics returning at every level. But the unfortunate part is with these contact sports comes injuries.
Yeah. So what do you see? What's the most common injury you see, and what ages do you work with this time of year?
So what makes my job, I think, so great and fun is that I see people from high school, college age, all the way through adulthood into retirement, into their 70s and 80s. And people can be an athlete, kind of at any stage, in their life. But in the young, high school, college age athlete, it's usually things like ACL tears or shoulder dislocations.
Yeah.
But as someone who's more mature, athlete, it's other things like rotator cuff tears or quadriceps tendon ruptures or meniscus tears as well.
So you're a shoulder specialist. I guess you probably do a lot of rotator cuffs, don't you?
Lots of rotator cuffs, lots of shoulder replacements.
Yeah, but you work on legs, arms, work on everything.
Yep. Yeah. So I mean, as orthopedic surgeons, we're kind of trained in everything. But what I specialized in and what I did extra training in was shoulder surgery and knee surgery.
And ACLs, I guess, are with football, you hear the ACL, the MCL, when you see these injuries on the field for football. That's become a pretty commonplace and the thing that all athletes worry about. But has the surgery on that, has the treatment for that improved enough? Because you hear about guys coming back from ACLs now and still going on and having a good career.
Yeah, I mean, I think it's one of the great advances in orthopedics, as a whole community, is the treatment of ACL tears. I think that, what we're starting to learn in the orthopedic community is maybe we're being a little too aggressive about getting people back. For example, Klay Thompson on the Golden State Warriors, he sat out for over a season after his ACL tear in the finals a couple of years ago. So, it's one of those things, it's individualized with the patient of, what's going on in their life and scholarships, and kind of how their rehab is progressing of when we have them go back.
And, of course, we keep talking about Christian McCaffrey from the Panthers. He keeps having foot and leg. I guess his latest one's an ankle sprain.
Yeah.
But he just continues to get hurt. And I guess today is the day, right? Today's the deadline for trading. We keep hearing that the Panthers may trade him. But back to sports injuries. I'm sorry I got off on the Panthers there for a second because I remember today's the trade day. What can you tell parents about sports injuries and particularly with young kids that are beginning to play football, soccer, hockey? What advice do you have for parents?
I mean, I think that a lot of these things can kind of be prevented and proactively treated. In another life before medical school, I was a personal trainer, and I did a lot of things with, help, training young kids and strength and conditioning. And I think that a good preseason and during the season, conditioning program is very beneficial. Having good core strength, good coordination, with whatever position you're playing. But then there's other simple things like having good fitting equipment or proper fitting equipment, shoes that fit properly.
So if you've got a kid that's going to be playing football, is there anything you can do to in the preseason? I know you say training and core training and all that stuff, but can you do anything for the legs to try to – I mean, that ACL injury is just something that if it happens, there's not much you can do about it, is there?
Yeah, unfortunately, it's one of those things that, no one's doing something to say, I might tear my ACL. It just kind of happens, in the heat of the game. But, if people have, they warm up properly, stretch, keep their quads and their hips, abductors strong, those are all simple things they can do that will hopefully prevent that situation from occurring in the game.
Okay, let's talk about treatment. What about after the injury? What kind of exams do you do, and what kind of treatments are there for the kind of sports injuries you see this time of year?
Yeah, a lot of it depends on what their complaint is and what the diagnosis is. probably the most helpful thing is a detailed history from the patient, because oftentimes when they're telling me their story about what happened, there's alarms going off in my head of what I think it is. And then the physical exam is just to kind of supplement what information they give us. So some of the exams we do is, we look at the extremity or the joint, see if there's a swelling or bruising or any deformity, see if there's any deficits in range of motion or strength. And then if it's a knee, then we check the ligaments, make sure everything's stable. And then everything from there, from the history and the physical, we usually have a pretty good idea what's going on. And
are there any non-invasive treatments? I mean, like non-surgery treatments for some of these injuries?
depending on what it is, usually if it's, if it's an acute traumatic injury, then that makes us worry there may be some structural problem in the knee or the shoulder that we need to investigate or diagnose sooner. But otherwise, there's things like physical therapy, or sometimes we'll do injections depending on the patient and what we think might be going on.
So is there a difference between acute and chronic injuries in the treatments?
There can be, yes. So if somebody
what is the difference? What's acute and chronic?
If you're going to put a number on it, it's usually around the 6 or 8 week is when you say something's acute or chronic. But acute would be if you said, hey, doc, I was fine yesterday and then I was running and I felt a pop in my shoulder. Well, that's something that's probably acute,
Yeah.
And, now I can't lift my arm, it hurts at night, my shoulder's weak. Sometimes more chronic is you're like, hey, man, it just snuck up on me.
Yeah.
I was fine and now, I don't know, it kind of hurts.
Mm-hmm. How long does it take to recover from rotator cuff surgery?
It's a long recovery. So it's about 3 months, total,
Yeah.
at least. I mean, people are usually feeling better before that. But the thing is, you take the tendon and you repair it back down to the bone, but then it's got to grow roots and heal. And that takes usually about 12 weeks.
So what's the most important consideration somebody should make if they're considering, coming to see you for orthopedic help?
I think the most important thing is that they trust their doctor. There's a lot of great surgeons in the area and in the state, and you want someone who can see you through this from the beginning all the way to the end. And if, very oftentimes, the outcomes are great, but rarely and occasionally, things don't turn out exactly how they planned. So I think if it's someone you can look in the eyes and trust them and know that they can support you through the thick and the thin, then that's who you'd want to be with.
So I've got this knee injury from my 30s from playing basketball at the YMCA in Chapel Hill, and I've never gotten it operated on. And I keep going to all these orthopedic guys, and they all just tell me to lose weight. So I'm going to come to you and see if I can get another diagnosis.
Okay. Yeah, that works. Yeah.
Because that one's not working.
Yeah. Yeah. I mean,
but that is the case, right?
No, we'll see. We'll see.
I keep saying, don't y'all want to cut me? Don't you want to get there and Henry, just lose weight? That's if you lose weight, you'll be fine. And it's funny. I did lose weight this summer, and it's helped a lot. So that is a big deal, isn't it?
It can be a big deal depending on what's going on. I mean, if you lose a few pounds, that makes a big difference in the stress and the force across the knee.
Yeah.
But there's other reasons that knees and shoulders and other things can hurt as well.
Dr. Shawn Yeazell, did I get it right?
Good job, Dan.
All right, now how do we get appointments with you? Where are you located, and if people want to come see you, and do you normally are you just referred to, or can people just make an appointment with you?
Yep. So we take referrals from your PCP, but we also I do self referrals. So to all the people out there, if you have shoulder problems or knee problems, call 252-816-4001. We'll work you in within 2 weeks. To be seen for anything that's wrong with your shoulder. It's what we do. We're a new group in the area. We're here to help. So, please think about us.
And if you want, I'm sure people can Google you, right?
Yep.
Yeazell is Dr. Shawn Yeazell, ShawnYeazell. Yeazell.
Correct.
All right. Good to see you, man.
Good to see you too.
Thank you so much.
No problem.
I'm
Thanks for having me.
coming for a diagnosis other than lose weight.